Good morning, everyone. Today we'll be discussing about bleaching, and in bleaching, in particular about the non-vital bleaching or the intracorneal bleaching. Bleaching is the lightening of the color of the tooth through the application of various chemical agents, mainly the hydrogen peroxide, carbamide peroxide, and sodium perchlorate, to oxidize the organic pigmentation in the tooth. And this can be of two types: vital tooth bleaching and non-vital tooth bleaching. In the first picture, you can see a single tooth is discolored. So this is like after trauma, the patient may report to you with discoloration of a single tooth, and when the patient comes to you like this, it's an individual tooth which is affected, and mostly when you check it, it will be a non-vital tooth. So in such cases, we'll use non-vital bleaching or the intracorneal bleaching. The bleaching is done only inside the those affected tooth. Whereas in second picture, you can see extensive discoloration, or in such cases, either you can do scaling according to the etiology, or you may go for the vital bleaching. So tooth discoloration is defined as any change in the hue, value, or translucency of a tooth due to any cause, and bleaching is we are trying to revert back the basic nature of the tooth, that is the hue, value, and translucency, back to its normal form. Basically, these stains are high molecular weight complex organic molecules, and when these bleaching agents are applied onto the tooth, namely hydrogen peroxide, these are converted into this organic pigmentation is converted into low molecular weight organic molecules, which are relatively colorless, or they have the property of reflecting the lesser, lighter shades of the spectrum, thus making the tooth appear as a lighter one. As you can see in this picture, initially the darkly pigmented carbon ring structures are there, which then converted into, when bleaching agents are applied, to lightly pigmented unsaturated structures, and then to completely bleached stains. In this stage, the third stage, the tooth is reverted back to its normal color. But if you continue applying the bleaching agents for a longer period of time, that is beyond the saturation point, this can even cause breakdown of the enamel metals. So you have to stop it at the right time. So today we will not be discussing the vital tooth bleaching, that will be covered in another session. Today mainly we are discussing about the non-vital tooth bleaching, in which post-trauma, when the patient reports to you with discolored one or two teeth, how will you treat such cases? First you have to do a root canal. It's a non-vital tooth. So first you have to do a root canal treatment for the tooth, and once you have done a good obturation with good seed, then you have to go ahead with the non-vital tooth bleaching. That is, in the pulp chamber region, you will be applying the bleaching agent. We'll see it in a picture, schematic picture. In this technique, it can be done as closed chamber technique or open chamber technique. Open chamber is one of the modification of this. It utilizes the sodium perchlorate. We have mainly three bleaching agents: the hydrogen peroxide, carbamide peroxide, and the sodium perchlorate. In the in-office intracorneal bleaching or the non-vital bleaching, we will be mainly using the sodium perchlorate because it has a slower and longer period of action. So sodium perchlorate along with water, saline, or 30 to 35% of H2O2, otherwise called as superoxide, can be used. There are many studies which shows that it is equally effective. Regardless of which material you are using along with the sodium perchlorate, it is equally effective. But there are also few studies which shows that 30 to 35% of the hydrogen peroxide, if you mix it with the sodium perchlorate, is slightly more effective than when you mix it with the saline or the water. You can choose any of this. And in the walking bleach technique, that is the in-office intracorneal bleaching, you will be using sodium perchlorate and water. But in case of open chamber technique, you can choose a lesser concentration one of carbamide peroxide. As you are sending the patient along with the tray and the bleaching material, you don't want to give a very highly concentrated 30 to 35% of H2, but you will be giving a much milder version of the bleaching agent. With this schematic picture, we can understand the non-vital bleaching well. In this, you can see the obturation. First, when the patient comes to you, do the root canal treatment. If suppose the patient has already done the root canal treatment from outside clinic and patient coming to you, take a radiograph and make sure that it has a good seal. Make sure that it has a good seal of the root apex in all the dimensions. And once it is sure, there should not be any periapical pathology or the patient should not be asymptomatic. The patient should be totally asymptomatic. And once they come to you, isolate the tooth nicely, remove the temporary or the permanent material, whatever there in the access cavity, and then keep the obturation as such. Remove the obturation up to 1 to 2 mm below the stain. This picture you can see. This is the CEJ region. From the CEJ region, 1 to 2 mm below the CEJ region, remove up to that point, remove the obturation. And keep GIC as a barrier material. In this, it is kept up to the CEJ level. Now the chamber is access cavity is open to you, and here you can apply the bleaching agent, namely the sodium perchlorate, along with water, saline, or hydrogen peroxide. Mix it and place it into the access cavity, and then close it with temporary material. Send the patient, wait for 1 to 2 weeks. Don't keep it for more than 1 to 2 weeks, as we have seen that beyond the saturation point, it is harmful for the enamel and the dentin structures. Recall the patient, evaluate the shade. If you have got the desired shade, then you can stop the bleaching procedure and then apply permanent material to this access cavity. But if you want to improve the shade further, you can even continue, clean the cavity, again repeat the same procedure, place a freshly mixed sodium perchlorate and water with or hydrogen peroxide again into the cavity and then seal it. After 1 more week, evaluate till you get the desired shade. I guess with the schematic picture is very clear, we can understand the non-vital bleaching. In vital bleaching, we are not going to inside the canal. Vital bleaching is always done to the labial side and lingual side of the exterior surface of the tooth. Whereas here we are actually doing it inside the tooth, that is in the access cavity. That's why it's otherwise called as intracoronal bleaching. Now we'll just see the technique clinically. Radiographically, first assess the status of the periapical tissues and the quality of endodontic obturation. If you feel that the obturation is questionable, the condensation, lateral compaction or the vertical compaction is not sufficient, please do a re-RCT. Should always be retreated prior to the bleaching. Here we can see a patient with a discolored tooth. These both incisors are discolored. So first you can evaluate the tooth color with a shade guide and take a clinical photograph so that later you can use this as a reference once the color is changed. And you can also use it as an education tool for the patient to show the change, what has happened. Isolate nicely, as these bleaching agents can cause burning sensation in the oral mucosa, lips and the gums. Isolate the tooth nicely. All respiratory material from the access cavity should be removed to expose the dentin and refine the access. Now certain steps have skipped over here inside we can't see the complete picture over here. Pack the pulp chamber with the bleaching agent. Before that, make sure that you are removing the obturation 1 to 2 mm below the CJ and placing GIC as the barrier. And then once the GIC is set, you can pack the pulp chamber like this with the bleaching agent and seal the access cavity with IRM or any temporary material for a good seal. Recall the patient after 1 to 2 weeks. This is one of the picture which shows the pre and post operative picture, how they have treated after applying the bleaching agent, what change has occurred after 1 to 2 weeks. Once you get this desired change, you can stop the procedure and seal the access cavity with permanent material. Another picture, pre-op and the post-op. Non-vital bleaching of 2-1. So that was the closed chamber technique. Suppose if you're choosing open chamber bleaching, in that case only slight difference is there. The obturation has to be should have the good seal, and then place the GIC barrier material and keep the bleaching agent inside the canal and keep it open. Don't keep the temporary material. If needed, you can keep a cotton wool pellet inside the access cavity for retention of the bleaching material, and then make a custom made tray for the patient, and this tray will be given to the patient. Once they go back to home, they can fill the tray with bleaching material and apply it onto the tooth. The bleaching material will go even inside the access cavity, so it will have effect both inside the from inside the tooth as well as the outside labial and lingual surface also. In this case, we have to choose a bleaching agent which has lesser concentration and lesser harmful to the surrounding mucosa, preferably carbamide peroxide of 10 to 15%. So these are the two techniques, open chamber and the closed chamber technique. Walk-in bleach is more commonly done. And these can be the complications of both vital and non-vital bleaching, which will be covering in the next session. Thank you.